Is root canal treatment safe or should you avoid it? Why are most holistic, natural, and integrative medical and dental providers telling you to avoid root canal treatment and choose a healthier option? Why has the safety of root canal treatment become very controversial? Why is the number of patients concerned about the risk of root canal and seeking healthier options rising? Today, I will discuss everything you need to know about root canal treatment and healthier options and compare holistic and biological perspective with conventional dentistry. I'm Dr. Maryam Horiyat, a holistic biological dentist at Aria Dental, where I provide a wide range of holistic dental services for all ages with the support of other expert dentists, board-certified periodontists, and anesthesiologists. More than 15 million root canals are performed every year in the United States. The question is whether root canal treatment is necessary for everyone or if it is safe for everyone. 6 key facts about conventional dentists versus holistic and biological dentists and their perspective on the root canal diagnosis. Fact number 1. Most patients who visit us for a second opinion after dentists recommended a root canal don't need one. In those cases, the root cause of pain and sensitivity is not chronic inflammation, infection, abscess, or necrotic dead tooth. Once the root cause of pain or discomfort is removed, the patient pain resolves without a need for root canal treatment. I believe, and there is more evidence, that root canal treatment is either overdiagnosed or misdiagnosed by many conventional dentists. Here is one of the many patients' testimonial.
I came here after looking into a way to save my tooth. I had to do root canals on, I would say, 3 teeth. Luckily, I was able to save 2. Unfortunately, I lost one of them due to the need for a root canal, but loss is better than having a root canal done. The other 2 were saved with treatment. And today I'm happy to say that I am a long life patient of Aria Dental.
Fact number 2. Most conventional dentists recommend root canal treatment or refer the patient to an endodontist for a vital tooth as soon as they see a large cavity close to the pulp on the x-rays or when they hear cold and hot sensitivity or discomfort without giving the tooth a chance to retain its vitality. If you've been told you need a root canal treatment, my suggestion is to get second opinion from a certified biological dentist affiliated with IOMT, IABDM, and Holistic Dental Orgs, a dentist who also offers ozone and laser therapy to give a vital tooth a chance to remain vital rather than killing it and leaving a dead organ in your body. Fact number 3. Even in case of hidden infection, necrotic tooth, obvious abscess on the x-ray, most conventional dentists or endodontists often recommend a root canal treatment without discussing any other innovative and healthier options such as holistic extraction, adjunct with ozone therapy, laser therapy, platelet-rich fibrin, and exosome therapy, and finally replacing of those missing teeth with metal-free zirconia ceramic dental implant to prevent any serious health condition. Fact number 4. Even though the few dentists who offer extraction, only a few discuss holistic extraction. The reality is that either most dentists don't know much about holistic extraction or they don't believe in them because they have not been trained to think outside of the conventional approach that works for some patients but not everyone. Fact number 5. In some cases, when patients request tooth extraction or natural alternatives to root canal treatment, conventional dentists often dismiss their requests and don't offer an alternative treatment to the root canal option. My patients frequently tell me that their previous dentist dismiss or ignore their requests. Listen to one of many patients' testimonial.
I came to Dr. Horiyat because I wanted a second opinion on a root canal that I needed to have done, and I had done some research about the risks of root canals and was really concerned about the long term. So when I came here, the first thing that I noticed is that she validated my concerns, and that immediately just felt like I knew I had found the right person. So she validated my concerns. She went over, the risks of root canals. She talked about some different alternatives. She really eased my fears. I'm not really fearful of a lot of things, but it was just this idea of losing a tooth and not knowing what to expect. She really eased my concerns more than anybody else. I honestly felt like my current dentist just kind of dismissed my fears, my concerns, and didn't really hear me. Anytime I mentioned anything holistic, they just sort of quietly, I can see them kind of rolling their eyes and not really taking it seriously. And Dr. Horiyat was really the first person who took my concerns and validated me. So she really takes the time to answer your questions. Again, in other experiences I've had with dentists, the hygienists are amazing, are usually the ones who spend time with me, and the dentist will kind of come through for 30 seconds, check, and then move on. She would literally sit with me for 10, 15 minutes, sometimes longer, and just go through and answer my questions. She would show me things on the computer. She would show me my teeth. And again, I've never felt from another, healthcare professional, just someone who really listened. So once the treatment plan started, it was great. We extracted the tooth. We then had an implant put in, and just every step of the way, I felt like she's just been like a partner in my health plan, in the treatment. She's just been fantastic.
Fact number 6. Unlike holistic and biological dentists who recognize the meridian link between the mouth and other organs, conventional dentists typically don't recognize it. In other words, despite significant scientific evidence, most conventional dentists don't believe that a dead root canal or an infected tooth compromises your immune system and overall health and may lead to a serious, irreversible, and degenerative medical condition. Let's dive more into detail. What is root canal treatment? Most people think that a tooth is not a living organ. In fact, a tooth is considered a living organ, and like any other organ, it is made of several tissues. A tooth consists of 4 tissues: enamels, dentin, cementum, and pulp. Together, these tissues form a tooth that function as a complete vital organ with its own blood supply, nerves, and connective tissue that's connected to the bloodstream and lymphatic system. Here is a healthy tooth. Inside the tooth, under the enamel, is a hard tissue called dentin. Inside of the dentin is a soft tissue called pulp that extends from the crown of the tooth into the root tip. The pulp tissue composed of blood vessels, nerves, and connective tissue and provides vitality and nutrition to dentin and cementum, keeping the tooth vital. When there is a deep cavity, crack, fracture, trauma, pulp inflammation, or infection occurs, irritating the nerve inside the tooth and in most cases causing a toothache. These are 3 stages of pulpitis or pulp inflammation. At first, transient and reversible pulpitis happen. So when the root cause of a pulp inflammation is removed, the inflammation comes down on its own and the pain resolved without a need for a root canal treatment. So your tooth can remain vital. If pulpitis becomes more chronic and irreversible, the patient's pain is not going to come down unless the pulp tissue is removed, or in other words, root canal treatment is performed. When chronic and irreversible pulpitis persists, then eventually the pulp dies and becomes necrotic or a dead tooth. Eventually, an abscess forms around the root surface and surrounding jawbone, sometimes with pain, sometimes without pain. When bacteria enters the pulp and penetrate the highly complex structures of a dentin and cementum, or when the necrotic dead nerve inside the pulp is left untreated. When the pulp is damaged or becomes irreversible pulpitis or necrotic, one way to treat the pain and prevent an abscess in the jawbone is to remove the entire tooth, or a procedure called tooth extraction. The other option is to remove the pulp within the roots and fill the canals. This procedure is called root canal, also known as endodontic treatment. Remember, by root canal treatment, only the soft tissue inside of the pulp is removed, not the entire root. Once the root canal is performed, the tooth is disconnected from its blood supply and lymphatic drainage. We basically kill the tooth and leave a dead organ in the body. The reality is that no branch of medicine leaves a dead organ in the body except dentistry, which has made the safety of root canal procedure argumentative and controversial. Besides, during standard root canal, only bacteria, infection, and dead nerve tissue are removed from the main canals. Small side canals are left behind and eventually become breeding grounds for silent bacterial infection. These bacteria enter the bloodstream and can silently cause disease in your heart, in your brain, joint, kidneys, glands, and other organs. These bacteria and their toxin also activate your immune system, leading to many different autoimmune diseases. Another question our patients often ask is, when do we know if our teeth are infected or unsafe? The answer is by using cone-beam CT scan, we can detect or monitor root canals for chronic infection or abscess in the jawbone. However, we still don't have a definite answer whose immune system does not tolerate a dead tooth. Does everyone get a serious health condition from a root canal? The answer is most likely no. However, we don't know who's at risk of an inflammatory response to root canal treatment that could lead to other organ diseases. If you wait until your tooth hurts or a tooth infection becomes chronic and obvious on x-rays, you're not necessarily doing your body a service. It may take years for an infection to become painful or obvious. Still, a silent tooth infection or inflammatory response to a dead tooth can cause systematic health issues immediately. Several studies, including Dr. Hal Huggins and Dr. Weston Price research, indicate that the root canal treatments are not healthy. This is why many holistic and biological dentists recommend extraction if your tooth is at the stage that requires a root canal. If you were told you need a root canal, I recommend consulting with a biological and holistic dentist to discuss alternatives before proceeding. If you need a tooth extraction, I recommend seeing a biological dentist who offers ozone and laser therapy to disinfect the surrounding bone and use platelet-rich fibrin, platelet-rich plasma, and exosome treatment to preserve the socket and replace the tooth with cutting-edge metal-free dental zirconia implant, not even conventional titanium dental implant, because they all contain metal ions. Thank you for watching this video. Make sure you subscribe and turn on your notification so you don't miss our future videos.